Top Med Talk.
Hello, I'm Joff Lacey and welcome to Journal Club Express on Top Med Talk. In this latest edition, we have selected the recent BJA publication entitled Prospective Observational Cohort Study of the Association Between Antiplatelet Therapy, Bleeding and Thrombosis in Patients with Coronary Stents Undergoing Non-Cardiac Surgery. This article reports the findings of the OBTAIN study, that stands for Occurrence of Bleeding and Thrombosis During Antiplatelet Therapy in Non-Cardiac Surgery. The lead author is Dr. Simon Howell from Leeds in the UK and is written on behalf of all the OBTAIN investigator team of the European Society of Anaesthesia. And you can find a link to the paper on our website, topmedtalk.com. The study looked to address the increasingly common dilemma regarding perioperative management of antiplatelet therapy for patients who have had coronary stent placement. Continuing dual antiplatelet therapy increases bleeding risk, whilst stopping may precipitate stent thrombosis and a major coronary event. The OBTAIN study was an international prospective cohort study and compared the incidence of these two major complications, that is, MACE, or major adverse coronary events, including myocardial infarction, cardiac arrest, and the need for PCI, and perioperative bleeding, defined by the need to return to theatre, a gastrointestinal bleed, intracranial hemorrhage, or spinal or epidural hematoma. And this was for a non-emergency, non-cardiac surgical patient cohort who had had PCI within the previous 4 years. The incidence rates were then compared for three patient subgroups: those receiving dual antiplatelet therapy, those receiving monotherapy with aspirin, and those who received no antiplatelet therapy whatsoever before, during, and after surgery. 847 of the recruited patients were eligible for inclusion, and 96 of those received no antiplatelet therapy. 526 received aspirin only, and 225 had dual therapy. Of all those, 32 patients suffered a MACE complication and 22 had bleeding. The unadjusted relative risk for MACE in the dual therapy group compared to only aspirin was unexpectedly found to be 1.9, though this was not statistically significant. And there was no difference in MACE between those who had received no antiplatelet treatment and those who continued aspirin over the perioperative period. However, bleeding was significantly more frequent in patients on dual antiplatelet therapy as compared with patients on aspirin alone, with a relative risk of 6.55. Similarly, in a propensity-matched analysis of 177 patients on dual therapy and 177 on aspirin monotherapy, the risk ratio for MACE with dual therapy was 1.8, but again, not statistically significant. And the risk of bleeding was significantly greater in the dual therapy group, with a relative risk of 4. So in conclusion, OBTAIN showed an increased risk of bleeding with those on dual antiplatelet therapy, but found no evidence for the protective effects against MACE for those patients. Limitations of the study throw caution to the widespread implications of these results, but it serves to highlight a possible unbalanced risk of harm to patients and requires further investigation. Many thanks for listening, and until next time, that's it from me.
Top Med Talk.
Nick Majerison here. Thanks for listening to Top Med Talk. Now all you need to do is find us on social media. We can be friends on Facebook. We can follow each other on Twitter. We can hang out on Instagram, or we can even gawp at each other on YouTube. Get onto your social media platform, whichever your favourite is, and you're likely to find Top Med Talk there. Whilst you're at it, make sure you've subscribed to this podcast so you never ever miss an episode. Helps us enormously if you do that, by the way. And check out the website, topmedtalk.com. On there you can find the email updates where we update you as to what we're doing each week. And whilst you're online, whilst you're doing your thing on the internet, I highly recommend you download all of the podcasts that we've put out here on Top Med Talk. We do an enormous amount of material here. A lot of it is incredibly valuable and, of course, will be in the future. So I just recommend you download the entire back catalogue if you could. Helps us out if you do that as well. And check out edpom.org/meetings, because if you go on there, you can find out where we're recording and what we're doing, because we go to the big meetings, the EBPOM meetings. You may have noticed most of our material comes from some of these wonderful conferences that are organised by evidence-based perioperative medicine. So, EBPOM, ebpom.org/meetings. Get yourself on there. And why not check out the Dallas Masters course, a Perioperative Care Practicum. Hopefully, I'll see you there.